Hi, I'm Bevra Hahn from UCLA, and I'm speaking today at the RWCS meeting, and my topic is how to prevent atherosclerosis in patients with rheumatic diseases. So there are about 3 messages. The first is there's good evidence that if we control disease activity in rheumatoid arthritis and in lupus, and that we reduce cardiovascular events and therefore improve survival. And the treatment in RA could be, there are data for TNF inhibitors, there are data for methotrexate, there are data for hydroxychloroquine, all reducing mortality and cardiovascular events. In lupus, there are data for controlling disease, but they're not in very large numbers of patients. Now then, the second thing that we want to talk about is beyond controlling disease activity, are there other specific things we could do to lower risk? And the answer to that is also yes. There is good evidence that the addition of statin therapy in patients with rheumatoid arthritis reduces cardiovascular events and improves survival. And there are recently good data in lupus that in patients who have hyperlipidemia, if you add a statin, that you reduce all-case mortality significantly. So obviously that's very important. Now another important caveat in that study is that you have to give a standard dose of statin. If you give less than the recommended standard dose of statin, you don't get the benefit on death from all-cause mortality. So we're waiting for those data to be confirmed by other studies. They come from Taiwan, and they include 50,000 lupus patients with hyperlipidemia. So in summary, when you're seeing patients, as you plan to reduce the disease activity, think also about things you might also do to reduce the chance for cardiovascular events, and that might include low-dose aspirin in people with antiphospholipid or people who've had any kind of clotting event, and introducing statins. And if you introduce statins, be sure to use recommended standard doses and don't underdose if you want to have a good effect. Now, will you have patients with myopathy and other side effects of statins? They won't be any more common than in the general population on statins, and they aren't very common, but in fact, you can work around them in most patients and have a good outcome in the very long term. Thank you.